Good morning, everyone. It's an honor to be able to moderate this conversation this morning as we reflect on what it truly means to advance health within our tribal nations and our communities. Our panelists, they really need no introduction at all. Still, I would like an opportunity to have each of you introduce yourself to our distinguished guest. Why don't we begin with you, Mr. Morello?
Oh, I sat in the third chair. So
Trying to avoid
I would
that
be last. Well, my name is Walter Morello. I'm the CEO of Native Health, the Phoenix Urban Program, and I also currently serve as the president of the board of directors for the National Council of Urban Indian Health. And I've been, I guess, like probably a lot of people, I've been in Indian health all of my life. My mom was a 35-year career person in the Indian Health Service, retiring in 1995, and I've been at Native Health, the urban program in Phoenix, for 27 years. So the entirety of my life has been spent in the Indian Health Service serving folks. So I'm really happy to be a part of the 70th year celebration for the Indian Health Service. So thank you all. Oh, I failed to mention I'm Choctaw, a member of the Choctaw Nation of Oklahoma.
Hey, Hani Washte Midakiapi. My name is Geraldine Church, and I serve as the president and CEO of the Great Plains Tribal Leaders Health Board. And I'm really excited to be here and just proud to be a part of the ITU system, and looking forward to hearing from my colleagues.
Good morning, everyone. Michael Wiaki. I'm a member of the Zuni tribe out of New Mexico and Arizona, and currently serving as Deputy Director in the Phoenix area. Previously have served as the Director of the Indian Health Service and CEO at the Phoenix Indian Medical Center. I think those are the bigger career highlights.
Thank you. It's a pleasure just to be with you all on this stage. You know, as we know, the mission of the Indian Health Service is to raise the physical, mental, social, and spiritual health of American Indians and Alaska Natives to the highest level. This mission is intentional. Spiritual health is not separate from care. It's foundational to it. Healing is deeper and more sustainable when it includes spiritual health. So when individuals are connected to their purpose, their identity, culture, creator, land, and community, we see stronger resilience, better engagement in care, and more lasting recovery from trauma. And recently, Secretary Kennedy has spoken about the importance of restoring spiritual health as a cornerstone of national wellness, emphasizing that modern health systems must address not only biological disease, but the loss of meaning, connection, and community that often underlies it. For Native communities and Native people, this understanding is not new. It is ancestral. Whole person care has always included the spirit. And with that in mind, I'd like to begin with our panelists, and I'll start with Ms. Church. How about that, Walter? I won't put you on the spot to start, and we'll start right in the middle. You know, thinking about that, Ms. Church, from your perspective, how do culture and spirituality support healing among American Indians and Alaska Natives?
Well, as you said, it's foundational. It really is. And what we know and what we've seen at Oyate Health Center is that when culture is the foundation, when traditional healing is at the forefront of the work that we do, people respond to that. They're seeking that, right? And it's been really easy to bring this worldview to the work that we do because it's instinctual as Indigenous people. We know instinctually that health and wellness is all of those things. It's mind, body, spirit. And so it's almost expected. And what sets us apart, though, I think, from other health systems is that it is expected, and from our relatives, and it's understood by our staff that when we connect at that deeper level, that we're going to have greater engagement, that we're going to give people permission to be involved in their healthcare journey at a much deeper level.
Nice. Mr. Morello?
Sure, I think it is vital. It is foundational. From an urban perspective, it's also very interesting because we can be from small border towns and be dominated by 2 or 3 tribes in the area, or we can be in large metropolitan areas and we have hundreds of tribal folks that we serve. So trying to understand the spirituality and the importance of feeling at home in a faraway place. Maybe your family is from that city, or maybe they have moved to that city. But it's an important grounding for us to build trust, to build respect, to build a confidence in an urban program that we're here to help healing, and that healing starts with an understanding of our foundation. And I think that's where coming into a place where people understand you and look like you and talk about you and joke around at the front desk and things like that is very important. And that's not part of the spiritual healing, but it's part of the comfort that we seek in urban programs, and how we develop that within our urban programs in a lot of our prevention activities, because some of us can be very small, outreach and referral programs, but maybe we receive SDPI programming and we can do a prayer walk or a healing or a gona or some sort of thing to ground us back into who we are as a people, as a person, back into our tribes and into our homes, into our homeland. So we see that as a very important aspect from the urban perspective, a foundation of how we operate.
Rear Admiral Viaki?
Yeah, thank you, Dr. Cotton. Before this panel, I was thinking, okay, how did I get selected to be on the spiritual panel? When Dr. Grimm got mental, Dr. Rubidoux got physical. And so I started to think, okay, how do I touch base with my spirituality? And I think that there's an important distinction that needs to be made between spirituality and religion. Some people definitely rekindle their spirituality through religion. Religion tends to be more structured, institutionalized, whereas I think spirituality is more organic and individual-based. And so for me, every year, I go back home and I chase elk through the mountains of Zuni. That's me getting back into my homelands, touching base and seeing the sacred sites on my reservation. We have many. We have a sacred salt lake in Zuni where we gather salt that we use in our prayers. We have Dowa Yalani, which is our corn mountain, which we've used for protection from floods, from raiding Apaches, from Spanish conquistadors. The history of our tribe goes millennia, but it was only 47 or 48 years after Columbus first set foot on the mainland here that the Zuni were killing conquistadors. So, going back to our homelands is driving spirituality. Many of us have sacred sites. Some of them may be on our current reservations. Some of them may be off our reservations. And so I think that the Indian Health Service has really not done as good a job in the spiritual aspect of our mission as our urban and tribal partners. We can do better, helping to support protection of sacred sites, protection of waterways, protection of the environment, the sacred foods that we rely on to help us rekindle our spirituality are just as important as our physical and mental health.
I really like that, the responses around balance and healing that you guys bring from your individual perspectives. But Admiral Viaki, just building off of that and knowing how that has helped individually for you, can you just talk a little bit about how you've seen those cultural and spiritual practices strengthen prevention and healing when it's applied to the larger community?
Yeah, and the unfortunate thing about being on the third panel is a lot of the great talking points on community-based interventions have been taken. But I think I'll point to my own tribe, the Zuni tribe, and what we did with our SDPI funding is create the Healthy Lifestyle Program. And it was all about reincorporating our traditional foods into our diet. Beans, squash, corn. Of course, we chase our local wild animals, elk and deer, rabbit. So those are healthy food sources, not relying on the USDA commodity cheese, which we all love to, in moderation. But it also had the program incorporated healthy exercise, whether that be physical running or walking, which again is in our cultural practice. We would have relay races within the Zuni tribe traditionally, and so reincorporating that type of activity is an important aspect of, again, spirituality and health.
Thank you. Mr. Murillo, why don't you bring us that perspective from an urban Indian?
Well, I think, as I mentioned before, in the cities, you're surrounded by a bunch of different cultures, and I think it's important to distinguish your identity. And, urban programs help you to reinforce your identity and reinforce the resilience that you have as an Indian person. And then also, as a center, often than not, we end up being community centers where people gather for various things, not just health care, but cultural things that we do. And all of that is part of healing, part of knowing who you are, part of listening to your elders. And so I think some of what we do is incorporate cross-generational programming that, maybe considered as outreach or maybe considered as ancillary, but it really isn't. It's a base component to being comfortable and being healthy. And so we think about things like, again, I'll mention SDPI because I think the flexibility of having SDPI in certain programs allows for programs to do things like like walks and hikes. I know some California programs do that. We do a camp in which we come back and we do, we have medicine men and others visit to talk about not just traditional ways, but also incorporating the science of what we know about diet and exercise and other things like that. So, using those things as a way of healing is very important, I think, and that's how we tend to incorporate those. And so resilience is very important when living in a city. Identity is very important, and it's all about knowing oneself and being healthy.
Thank you for that. Ms. Church, just from your perspective as well, how have you seen that our cultural and spiritual practices strengthen?
Yeah. One of my favorite programs at the Health Board and Oyate Health Center is our Connecting with Youth program. And what we've done is we have brought in our knowledge keepers to work with our youth and to teach them about many of our traditional practices and our life cycle and our seasonal cycle. And participating in these activities, what we've seen is a 10% drop in suicide ideation and attempts. So we know that with that age group. And so we know it makes a difference, right? Another activity that our diabetes program is involved in right now is planting a garden. Part of the garden is healthy foods, of course, but we're also integrating some of our traditional medicines in that garden. When I was at Detroit at the Urban Indian Health Program there, we did something similar, and it's an opportunity to pass on knowledge, but it's also an opportunity to look at how our traditional practices around food, integrating traditional food can make a difference in how healthy we are, what we put in our bodies, and utilizing those traditional foods in a way that our ancestors knew made a difference in outcomes.
Absolutely. I'll start with you then on our next question. Just going over all of those programming and the way that that's been reincorporated for our communities, what helps to ensure that those practices are supported in respectful and meaningful ways within the healthcare system?
When the health board assumed management of what was formerly Susan to become Oyate Health Center, we did a needs assessment, and incorporating traditional knowledge and traditional services was at the top of the list of priorities that was identified by the community, that and behavioral health. One of the things that we did is we brought together those knowledge keepers from across the region, and we did focus groups with them and talked with them about exactly how to go about doing that. What is the appropriate and respectful way to bring in traditional knowledge, traditional healing in a clinical environment? From that exercise, we then established what we call the WIACSAPA committee, and these elders and teachers are a part of that WIACSAPA committee, and we meet with them quarterly. They are the ones who guide our work. It's one of my favorite advisory committees that we have. It can be very intimidating to sit amongst those that are very well known and respected for traditional knowledge and facilitate meetings, right? They take care of themselves, but they have really guided our work. And a couple of things that has been predominant in the feedback that we've gotten from them is that this cannot be just ancillary work. It has to be integrated and infused in everything that we do. It's not an adjunct service. It is a part of our administration. It's a part of not only our behavioral health and diabetes program, but all of our programming. Language is key and core to that work. And in addition to that, I think what they bring is structure. So understanding what is appropriate to do in the clinic itself and what is appropriate to be done outside of the clinic, and taking our relatives to the right healers for certain conditions or issues that they're looking for. So being very intentional about how we bring services into the work that we do, and understanding that it cannot just be something we do, but it has to be how we live and how we integrate that into our mission, our vision, and our values.
Mr. Murillo, what about you? What helps ensure these practices are supported in respectful and appropriate ways within urban Indian health systems?
Well, thinking about this question, I really started thinking about the process we took in Arizona about starting the process of getting reimbursed for traditional healing services. You know, it's a process that started nearly 2 decades ago, led by tribal leaders through the Advisory Council on Indian Healthcare, a state organization, and the late Alito Montiel. And taking together an understanding that this needed to be tribally led, and that it needed to also include many tribes. There's 24 in Arizona, but they also reached out to include urbans in the planning. And so that was really important as we started thinking about how do we recognize this, and how do we work forward to kind of make rules into something that we all did and our programs do that we never thought about making rules for, or writing it down into a CMS 1115 waiver of all things. So trying to translate who we are into a government regulation was an interesting process, and that took about a decade. And we put that that waiver forward, and it got put on hold for other things, and then finally, with 3 other states, were approved. And in doing so, it really was about how do we formalize what we know we've been doing. A recognition. It's interesting because we all are obviously in healthcare. We all know that money drives the issues. How you get paid or what you get paid sometimes dictate the service. And what was interesting is we started contemplating how we start formalizing our traditional healing service. You know, when somebody needed a medicine man, we just called that tribe and found a local person to treat that patient or their family. But now, how do we formalize that in a form, in a process, and credentialing and privileging and all that kind of nonsense? But it isn't a new concept to us, and I think that's kind of what we're facing, is that it's not anything new. It's really just making what's old into the current system of modern-day healthcare in the United States. And so as we start thinking about how does that integrate with things, with Arizona's model isn't focused on behavioral health. It's focused as a referral source from behavioral health, but also from primary care. And how does that integrate into all of medicine? Our primary care docs can refer people into that. Oddly enough, Arizona, they didn't include urbans, even though we were authorized for urbans. And but then it opens the idea that how do we deal with PIMC, who's had a sweat lodge and who has other things. But we're finding that the Indian Health Service is having issues, of course, with FTE and again, processes and other things like that. But working together to resolve that so we can get to this service, and I want to reiterate that it's not a new service. We've been doing it for decades. But how do we get it to a point where now we can be reimbursed and it can maybe thrive and flourish with the addition of new dollars? So that's where we are, and I think understanding that it's integrated within all aspects of healthcare, and I really always want to take a step back that just because it's now recognized by the government as a process doesn't mean it's new to our communities or our people. But we do have to find a way to formalize these things, which is a great step that we're taking now. And I think that's the challenge we currently have, but it's also a great tribute, I think, at least in Arizona, to the tribes and Indian Health Service and urban programs working towards something, taking decades to do, and then achieving it, and the recognition, by the federal government that this is actually part of the Indian health system, actually part of the Indian health process.
Exciting and impactful work. Admiral Wiaki, just from your perspective in the federal system?
So thinking about this from the federal perspective, I think one of the aspects that's important from the question is that respectful inclusivity, making space for this programming within our federal sites is important. And a program to highlight is Phoenix Indian Medical Center. They actually have had for maybe 3 or 4 decades now a traditional cultural advocacy committee that's a structured committee of the governing body. So members are appointed, their reports and activities come up through governance and are recognized and respected. They also, just in the last 18 months to 2 years now, put together the work to create a position description for a board-certified chaplain. And that person was hired. We have the very first chaplain in the federal service, Dr. Charles Parker, and he kind of chairs that committee and works with the traditional practitioners to make sure that the sweat lodges are being facilitated appropriately, ensure that our policies are written in a way that incorporate traditional practice. And I'm glad to hear that it's not just the federal side of the house where we have challenges like Esther mentioned with the attorneys and the employees' concerns. We have similar concerns on the federal side with fire codes and making sure that we allow folks in the room to participate in ceremony at certain times of the day or night as the patient needs dictate. So all of those are incorporated into our policies. I also think a foundational piece is making sure that we as organizations hire individuals who know and understand and respect culture and the spirituality. So that's a foundational piece that's important. And I think one thing that we're going to be struggling with as we work to implement the new demonstration projects on traditional healing is recognition of credential or community recognition. We were even talking about some aspect of credentialing, if you will. And then how do you reimburse for traditional practice? We heard the chainsaw is a perfect example because we don't traditionally hand over money. You provide an offering or an honorarium. And so working through all these types of iterations as we implement will be fun, I guess you say.
Like I said, it's exciting and impactful. Mr. Murillo, I'll start with you on this question. How can our shared understanding across the IHS tribal and urban Indian health settings help sustain culturally centered approaches to care?
Well, I think discussing PIMC is very important. Working closer and together, and Phoenix is an interesting model in which you have very, very close urban programs to tribal programs, and a very large Indian Health Service direct service unit. And I think with an understanding that the need in Phoenix will always exceed the resources in the entire ITU system. And so working more closely together, and we can start with traditional healing. How do we work more closely together? In Phoenix there's hundreds and hundreds of tribes, and how do you address all of their needs, or as many needs as we can of those individuals? And that's not going to be one body. It can't be PIMC. I know they're a federal system and working through that and making great strides, but also, we've been in discussions with them, and how do we pick up some of that slack or some of the other areas. So I think partnerships and working more closely together is with care coordination agreements as well. As I mentioned, these are things that have existed in the Indian Health Service, but somehow get formalized when CMS and dollars get involved. But they've been there. And I think what we have to do is highlight them and expand them when possible. Closer relationship with tribal health programs to urban programs, I think, is fundamental. And when it comes to traditional healing, we need each other. We need to know who are recognized people in those tribes and communities that can do some spiritual work in the population. And you can't create them. You have to rely on that tribe to refer you to people who are qualified in that sense to do that work. And so I think this is going to hopefully draw us closer as a system, and I think and rightly so, because as Geraldine said, this is the foundation of health in our people. So hopefully this aspect of healthcare brings us closer in a more closer working relationship across the system.
Ms. Church?
Yeah, I think it's important that at the federal level that to recognize the enormous diversity across the ITUs and across the country, that traditional healing is going to look very different in the South than it is, in the Northern Plains and from the East Coast to the West Coast. So, keeping that in mind when creating policies and constructs around how these programs are going to be supported and implemented. That same diversity also offers an opportunity for all of us to learn from one another. I mean, even in the Northern Plains, we have diversity. So what programs are going to look like in North Dakota are going to look very different than what they look like in Pine Ridge or Rapid City. But there's an opportunity to really learn from one another and how things are implemented. And then again, just recognizing that this is foundational to wellness and health, and that however it is implemented, that we recognize and support that it's needs to be infused in all of the work that we do, not just the services, but in the organizational culture, in how, even in administration. So those are the main things that come to mind when I think about how to implement and roll this out as in the larger context.
Admiral Wiyaki?
Yeah, when I was thinking through this question, what came to mind for me is the importance of continuous education and training of our team members, not only within our systems of care, but our federal partners, our state partners. They need to know before we can move forward what our history has been. So the important aspect of trauma-informed care, reminding people about the past failed policies of termination and relocation and the destruction of family structure and religious ceremony, that it's important that we recognize and respect that before we can move forward, because we need to build our interventions to heal from what has happened. And some of it intergenerational, some of it even today, showing in things like domestic violence and social ills of over drinking, overeating, etc. So I think putting some resource into the education and training, whether that be on the federal side, tribal side, urban side, we need to make sure that people are continuously reminded what our populations have gone through.
This conversation is so important for all of us out there doing the work and also living among our people and sustaining our own cultural practices. Mr. Murillo, are there closing comments that you'd like to share with the audience?
Well, I gave a little history in my introduction of my involvement with the Indian Health Service, so it's great to see a celebration of a service run by our people, for our people, and I think that needs to be a great understanding, and see the proliferation of providers now, and a focus, and also highlighting the real need to continue to educate our youth, to incorporate them into our values and our traditions, but also encourage them to become providers. I think where we see the provider shortage across the ITU system is going to only get worse. As I mentioned in Phoenix, even just the resources are not enough to meet the demand, and that we always need to recognize that while we have constraints, and the constraints may be dollars, we can't remember that those constraints are all of the demand. It's only what we're allowed, what we can see based on our budgets. But what we need to do is think about growth. And I think with self-governance and the innovation of tribes and the innovation that you see within urbans really lead to that. But I think we should be investing now into a future that is a generation away, and that is to become the healers in Western medicine that we should be as a system. So coming from an IHS family, my mom was at Haskell and at Riverside and Red Lake and just all over the place. And I was born, in Sitka while she was at Mount Edgecombe. So having been born into the system, I see how the system has advanced, but I also can see how we can proliferate and be very successful with that. And I think that starts with self-governance, and I think that understanding that we need to plan today for 20 years from now, and that's with providers of healthcare.
Ms. Church, words of wisdom you'd like to leave us with?
I was thinking about this celebration today and the coming together of many people in the ITU system celebrating 70 years, and also the full circle of bringing traditional healing and spirituality into our work. And it's our ancestors that are present, right? They still guide us, influence us, and direct us. And the ITU system is sort of like a family, right? We don't always agree. Sometimes we'll even have our, strong differences. But in the end, we're all here together to make a difference in our communities and in our families. And what I'm reminded of is that same strength that our ancestors drew from spirituality, that we continue to draw on that as well as we go into the next 70 years, and that we do our best to live by those teachings and those values to guide our work and lay the foundation for those going before us.
Admiral Yaki?
Yeah, I think first I just want to mention what a true honor it is to be invited to participate in this 70th year anniversary recognition. And I think that for the agency right now, the word of the day is realignment. And going back to Clayton's opening comments, the importance of continuously evolving our agency to meet the needs of our communities is vitally important. And we heard the numbers were at about 60 to 65% of tribes who have self-determined, self-governed. But we'll also always probably have tribes that are going to hold the federal government to their original commitment and never self-determination and self-govern. And meeting that mission, complex mission of both direct health care and facilitating resource and support to our tribes who are now self-governing their programs. It's hard. It is a difficult mission. So I very much respect my predecessors, Dr. Grimm, Dr. Rubidoux. I had the opportunity in one of Dr. Rubidoux' fellowship classes to mention to her students that she was one of my healthcare heroes coming up, and so happy to take the baton from them and look forward to that baton being passed to future leadership as we continue to evolve and improve our system of care for our relatives. Thank you.
Such good words from all of you. I want to say it's just been my pleasure to sit with these panelists as they share their perspectives and thoughts on how healing is much deeper and more sustainable when it includes the spiritual health aspect of our mission. Will you just join me in a round of applause for our panelists?
Produced by the U.S. Department of Health and Human Services.